So, sir, you seem to have anticipated my next question, which was about how, like, for instance, chest pain or pain in the stomach can be because of heart attack, but it can occur in other medical conditions also. It can occur when there is indigestion, or so. How is a lay person to distinguish whether this is a heart attack or whether this is an innocuous condition for which he or she can take Digene or some kind of medicine to relieve gas or indigestion?
See, both the physician and the patient themselves have to dissect this symptom. Dissect in the sense, suppose there is a symptom of gas, flatulence, which is coming suddenly, which a person has never experienced. Most of the people who have so-called gastritis, they keep feeling this symptom off and on. Anything which is a new onset, unusual. Nothing to relate to the food or type of food. If someone had a spicy food from outside and developed such burning sensation or flatulence, it can be probably gas. But as a routine, if someone has developed a new gas type of symptom, then it should warrant the further investigation. Similarly, the chest pain. Chest pain can be there due to heart disease. Chest pain can be there due to multiple other reasons. Because in the chest, there is a skin, there is a bone, there is a lung, there is a pleura, all can give rise to pain. But there is heart also. So discomfort of cardiac origin, mostly, of course, it is a sudden in onset, but it has a very peculiar discomfort. Unlike the pain of, say, like costochondritis, that inflammation of the bone of the chest, the bone ribs, which is joining the central bone sternum, it produces a localized pain. It is not diffuse. It doesn't radiate. And the pain is constant. Discomfort of the coronary artery disease, it would come, it will either build up or after some time it will disappear. But this, suppose we are talking about, say, like pain of costochondritis, pain will be there all the time. Similarly, pain due to pleuritis, it will aggravate with the breathing. There would be accompanying fever or other symptom. So we have to correlate with other symptom also. But as far as this gas symptom is concerned, yes, it is most innocuous, because half of the heart attack patient, they miss the timeline because they keep thinking that this is a gas. Not only the patient, even physician make mistake. This is just a gas. So any symptom which is very unusual coming first time, especially in the people who are a risk model, having a multiple dose risk factor. Because same thing happening in a thin person who is non-smoker, non-diabetic can still be gas. But a diabetic patient, a smoker, says suddenly I am developing such symptom, it should be viewed as suspicion.
So if I understand correctly, sir, those who are already who already suffer from a variety of risk factors, which you outlined earlier, they should be alert and vigilant about anything unusual happening, any kind of pain which they are experiencing for the first time, that needs to be investigated and maybe calls for a visit to the doctor.